Today in the media conference with Goel, which is brought to you by V4 News, Global TV, V4 Stream, Malnadu TV India, News Gaon Se, Samvad Sarokar News, Bharat Post News, Organ Donation India Foundation and Gyan. Our endeavor is to enlighten you with the current topic. And today our topic is not only current, but it's very, very relevant. And the topic is breastfeeding myths and facts. Breastfeeding is the process of feeding human breast milk to a child, either directly from the breast or by pumping out the milk from the breast and bottle feeding it to the infant. The World Health Organization, WHO, recommends that breastfeeding begin within the first hour of a baby's life and continue as often and as much as the baby wants. During the first few weeks of life, babies may breastfeed roughly every 2 to 3 hours, and the duration of a feeding is usually 10 to 15 minutes on each breast. Older children feed less often. Mothers may pump milk so that it can be used later when breastfeeding is not possible. Breastfeeding has a number of benefits to both mother and baby, which infant formula lacks. Increased breastfeeding globally could prevent approximately 820,000, that is 8,20,000 deaths of children under the age of 5 annually. Breastfeeding decreases the risk of respiratory tract infections and diarrhea for the baby, both in developing and developed countries. Other benefits include lower risk of asthma, food allergies, and type 1 diabetes. Breastfeeding may also improve cognitive development and decrease the risk of obesity in adulthood. Mothers may feel pressure to breastfeed, but in the developed world, children generally grow up normally when bottle fed with formula. Benefits for the mother include less blood loss following delivery, better uterus contraction, and decreased postpartum depression. Breastfeeding delays the return of menstruation and fertility, a phenomenon known as lactational amenorrhea. Long-term benefits for the mother include decreased risk of breast cancer, cardiovascular disease, and rheumatoid arthritis. Breastfeeding is also less expensive than infant formula. Health organizations, including the WHO, recommended breastfeeding exclusively for 6 months. This means that no other food or drink other than possibly vitamin D are typically given. After the introduction of foods at 6 months of age, recommendations include continued breastfeeding until 1 to 2 years of age or more. Globally, about 38% of infants are exclusively breastfeeded during their first 6 months of life. In the United States, in 2015, 83% of women began breastfeeding, but at 6 months, only 58% were still breastfeeding, with 25% exclusively breastfeeding. Medical conditions that do not allow breastfeeding are rare. Mothers who take certain recreational drugs and medications should not breastfeed. In 2020, WHO and UNICEF announced that women should continue to breastfeed during the COVID-19 pandemic, even if they have confirmed or suspected COVID-19, because current evidence indicates that it is unlikely that COVID-19 can be transmitted through breast milk. Smoking tobacco and consuming limited amounts of alcohol and or coffee are not reasons to avoid breastfeeding. When you are pregnant or right after you have your baby, well-meaning friends and family may want to give you some breastfeeding advice, but that advice may not always be based on the truth. Many new breastfeeding moms don't question what their more experienced friends and family members tell them. It can get confusing. Well, it is time to bust some breastfeeding fiction with a little reality. Here are a few facts about common breastfeeding myths. Now I'm giving some myths which are very common in the public at large, and especially the mothers who are breastfeeding. You won't make enough breast milk if your breasts don't grow during pregnancy. You have to wash your nipples before you breastfeed. These are the myths. So I'm giving you the myths. What are the myths which are common, but one should check, but they are myths. Don't breastfeed if you have bleeding nipples or blood in your breast. You should not breastfeed if you smoke. These are, again, I'm repeating, these are myths. Please be careful, because it should not happen that you will say that in the media conference, I have mentioned that these are facts. Do not breastfeed after you exercise. It means you can very well breastfeed after exercise. You cannot breastfeed for 24 hours after you get a vaccine. It means even after the vaccination, right now we are all are going for COVID-19 vaccination, you can feed after the vaccination as per the time schedule of the baby's milk. Stop breastfeeding if your baby has diarrhea. In case of diarrhea of baby, please don't stop the breastfeeding. Rather, breastfeed is very good for the diarrhea to stop. There is not enough iron in breast milk for your baby. This is again a myth that there is not enough iron in the breast milk. You can wake up one day and your breast milk will be completely gone. Again, there is a myth. This is not going to happen overnight. So these are the myths which are prevailing. Many other myths are there. So we have to understand what are the facts or what are the myths and more other myths or facts. And today, to discuss this very, very important and relevant topic, we have elite panel or panelists who are authority, who are knowledgeable, experienced in this particular field. So I would like to introduce and invite my first guest. He's Dr. Yogesh Kumar Gupta. Dr. Yogesh Kumar Gupta is the consultant pediatrics and head of PICU, Fortis Hospital, Bangalore. Dr. Yogesh Kumar Gupta is a well-known pediatrician and pediatric intensive care specialist with more than 15 years of experience in the field of child care. He has been gold medalist throughout his medical residency program. His area of interest includes pediatrics, pediatric intensive care and neonatal intensive care, pediatric allergy asthma, pediatric nutrition, and pediatric psychosomatic illness. He completed MBBS from Kasturba Medical College in 2005, MD in Pediatrics from Kasturba Medical College in 2009, and DNB Pediatrics from National Board of Examination in 2015. He is a fellow in postgraduate program in pediatrics nutrition from Boston University. Welcome, Dr. Yogesh Kumar Gupta on our show. Dr. Yogesh Kumar Gupta, you are associated and doing lots of work only in this field of the pediatrics, and you are coming across almost all the newly born child as well as the breastfeeding mothers. And definitely the first question, many questions which the breastfeeding mothers are asking you about the breastfeed. And definitely you are coming across all these questions and you are telling them what are the facts. So we would like to know today from you the breastfeeding myths and facts. Dr. Yogesh Kumar Gupta, please.
Thank you, sir. Thank you so much for such a kind introduction. And it's my pleasure to be on this platform. You have given me a wonderful opportunity. So as sir, you already discussed a lot of things about the myths and facts. But let me tell one thing is in past few years, we have definitely seen that the rates of breastfeeding in our country, let's say talk about India, have gone up actually significantly, like less than 40% to around 56% in present year. It means out of 100, at least 50 mothers or 50 or 60 mothers prefer to exclusively breastfeed their babies. Now, what has happened is that's actually a positive point. But what has happened during this COVID era, last 1 or 2 years, there have been so many other myths which have hampered the breastfeeding also, especially the mothers who had COVID during the pregnancy or who became positive during delivery. And then the big question comes is, do I breastfeed my baby or not? Because everybody is scared of this new virus, and a lot of hype is going around about, the mortality, and which is actually true also. I wouldn't deny that, because this virus is new and has been causing a lot of trouble. So they don't want to kind of pass on this virus. So they always say, no, I don't want to breastfeed because I don't want to, transmit the virus to my baby. So there are a lot of myths associated with this. So probably I'll be coming to that in some time, because I think that also has to be kind of clarified. But as you rightly said, the first contact when the baby comes out is with us, being the pediatrician. And it's like, when we talk to the mother, she said, like, she has so many doubts in her mind, because especially a new mother who's just a young mother and who has just delivered a baby with little support because of the nuclear families we have now. So many questions and so many myths have been going on, as you rightly mentioned, which have been passed on by their, generations. So the first and most foremost question what we get is, doctor, will I be able to breastfeed? Such a big doubt, a mother has. So what my answer to that is, of course, see, that's baby's right. First, right, the only thing which you can do, best thing you can do for a baby is breastfeed your baby, because your milk is something which has everything, and it's like a liquid gold, what we call, which you're going to give to your baby. So we always encourage them about the, you need to continue breastfeeding, and we encourage breastfeeding as early as half an hour of, as early as within 15 minutes of delivery and within half an hour of a cesarean section. So that is something, because once the baby develops that bonding, then it's always a plus point for the mother as well as the baby, and it enhances the cycle which forms the milk will start kicking, and then they will have a good flow, and that the bonding happens. Then what happens is, next question what we come across about the, around this over the, let's say, next 24 hours is, doctor, my baby is crying a lot and I feel there is no breast milk. So we need to kind of, clarify this to the moms, especially the new moms, that look, nature is such a way that it has whatever we know, that initial quantity of the breast milk will be very minimum, which is a special milk, what we call colostrum. And actually it's a magic potion, which has liquid gold, which we refer, is basically that only, because it has abundance of antibodies. Now remember that your baby is born with minimum immunity. Whatever immunity you have passed to your baby, that's all baby has. So baby has to develop immunity once it comes out of you, and he has to survive in this world to fight the infections. And how does that happen? So when you give your initial milk, the colostrum, it's such a wonderful thing that it lines the, starting from the mouth till your anal canal, it will line the whole of the gut. And such rich antibody portion is going to give some protection to the oral cavity, to the intestines, and help in fighting the infection, which the baby gets exposed within first few hours of life, to the bacteria which they get exposed within few hours of life. So that colostrum is rich in fat also. So that should give enough calories and enough energy to your baby to sustain for next 2 hours. So though the quantity is less, but we encourage them to give that milk and feed every 2 hours. You don't need to give top of formulas. You don't need extra milk, because that is not required. It should be sufficient for your baby. Another thing, what we come across is, as you rightly mentioned, some of the babies, the feeding techniques may not be correct and they have bleeding nipples and all. So they say, no, we don't want to feed the baby with this because, it can cause harm to the baby. So we always tell them, look, there is nothing like that. Of course, we need to correct the feeding technique, because it may not be easy for you to feed with the pain, because when you're feeding the child, you should enjoy it. You should get that positive vibes, and you should transfer it to your baby also. So you need to correct the position of the latching, and then after that, these problems can be sorted out. But please continue breastfeeding. And how, then next question, they say, is it enough for my baby? If I'm feeding, let's say you are encouraging me to feed, but when I feed my baby, how do I know that my baby is adequately fed or not? What are those symptoms and what are those things which I look for, which tells me that my baby is adequately breastfed? So answer again lies, very simple answer is that if your baby feeds for 15 to 20 minutes, if your baby sleeps well after feeding, if your baby passes good urine at least initially 3-4 times in a day in the first few days of life, and if your baby passes good stools after feeding, it means you are giving adequate milk to a baby, and you don't need to rely on other things also. Then as they get discharged, another question which Dr. Lal raised is many mothers ask, very common myth, that, okay, if I start exercising, then I will produce lactic acid. Of course, we know that lactic acid is produced when you exercise. So then my breast milk gets spoiled and I won't be able to give it to my child. So we always tell them, see, this is something absolutely a myth, because see, whatever is happening, the production of the milk, it's going to be such a way that when it goes to your baby, most of the toxins what you have like in your diet, or most of the allergens, most of the medications what you have, actually gets filtered before it reaches your baby. Of course, some amount may be released in the milk, but it's not going to harm a baby. So you should continue even your exercise. Now, coming to the most important thing which I wanted to highlight in today's talk was COVID and breastfeeding. As I already mentioned, that many mothers have this fear of passing the virus to their baby, and majority of them actually, when it started, they started taking a decision that I want to formula feed my baby because I don't want to transmit. I don't want to go too close to my baby because I might pass the virus to him. So before we, understand that, we have to tell them the importance of breast milk. And to highlight the importance of breast milk, what I always tell them, a drop of breast milk, what all it contains. It contains, of course, it contains water, it contains proteins, it contains sugar, fatty acids, antibodies, vitamins, minerals, antibacterials, antivirals, anti-inflammatories, and as many as almost 800 strains of bacteria, which are helpful for your baby. Now, if your baby is missing on this, imagine, are you doing a good or are you doing a harm to your baby? Of course, you're doing harm if you're not providing this wonderful gift of nature to your baby. You're just doing more harm rather than doing any good. And when we talk about immunogenicity of the breast milk, if people would be surprised if I tell them the one, as I mentioned, what all it has. It has anti-inflammatory actions, so chemical protection. It has cells in it which protects against antifungal, which are like antiviral, antibacterial. There are lymphostimulatory cells in that. There are a lot of things have been spoken about interleukins, TNF alpha. So all these are anti-inflammatories which actually help the baby to fight the infection. Second thing is, we saw during 2003 also, when we had a SARS COVID-1, first epidemic or pandemic. That time also, what was found out, that breast milk contains something called as lactoferrin, and this lactoferrin actually has been shown to block the receptors, the ACE2 receptors. And we all know about ACE2 receptors, that these receptors actually help the COVID virus to enter the body. So when you're giving your breast milk to the baby, you are actually transferring something called as lactoferrins, which are going to block the receptors of a baby's respiratory as well as your GI tract, and prevents actually or decrease the extent of COVID infection. So that is the importance of breast milk during COVID. So what we say is, the encouragement is, as soon as your baby is born, they should be allowed to breastfeed. The initial skin to skin contact should be given to the mother and the baby wherever possible. And mother should follow certain precautions. Of course, there is a very minimum risk which mother can transfer the virus to the baby. So if we follow the protocols, if we follow those hygienic methods, there is no chance that we're going to cause harm to the baby. And what are those precautionary method we tell? So when you are deciding that you are going to breastfeed your baby, if you have COVID also, we always say that first wash your hands. Make sure you wear a mask while you're feeding the baby. Cleaning of the local area or the breast tissue is always advised, especially during this setting when there are chances of contamination. And once you have fed the baby, once you have burped the baby, try to maintain a distance of at least around 6 feet between you and the baby, but you should be in the same room. So that's how and that's had been recommended by all the bodies around the world, that they should be encouraged to breastfeed irrespective of their COVID status. Let's say if mother is sick, very sick, and she's suffering from COVID pneumonia and she can't breastfeed the baby? The answer is again very simple. We encourage them to express the milk. Take that milk, because our main aim is to make sure that that milk is given to the baby. So expression of the milk is done under hygienic conditions, and that same thing gets transferred to given to the baby. So at any cost, we always recommend that COVID or no COVID, mother should breastfeed their baby. And same thing comes from all the bodies, like CDC says mother should breastfeed irrespective of the COVID status. WHO says as early as possible, mother should be allowed to breastfeed the baby, even though she is positive. Our Indian Academy of Pediatric also emphasizes that breastfeeding should be given to the baby irrespective of maternal COVID status. And including the ICMR also says that mother should be encouraged to breastfeed or express the breast milk and they should practice hand hygiene. So this is about the COVID. So what my message here is very clear, that we want all the mothers to breastfeed irrespective of their COVID status. Don't have any fears, because if you don't feed the child, you're going to do more harm rather than feeding a child when you're suffering from COVID. Follow all the precautions and make sure to have a good contact and good kind of bonding with the child. So because it helps in further improving the feeding. Another question, myth what we come across nowadays is that first of all, I don't want to get vaccine because, I might harm my child. Again, that's a big myth. Vaccination, we all know they protect. And we have seen that COVID vaccine, 2 doses when they have been given, they actually decrease the chances of getting infection, or when somebody gets infection after having 2 doses also, the severity is very less. So for us, definitely baby is also important, mother is also important. So if a mother who has been breastfeeding, we encourage them to go for the vaccine, because vaccine is not going to do any harm. In fact, let me highlight one more point. The antibodies which mother forms after getting the vaccine are actually secreted in the breast milk and are given to the baby. So indirectly, of course, we cannot vaccinate the baby, but indirectly, those antibodies get transferred and helps in developing the immunity of the baby against the virus. Of course, mother may have some amount of fever on that day, which can be managed, but she should continue breastfeeding. There should not be any stoppage on that. Another thing what we come across is they say that when I have cough cold, I should stop my feeding my baby. Of course not. See, as I mentioned, breast milk is something which is coming filtered. So whatever you have, it's not going to should be affecting the baby, and the anti-inflammatory properties of the breast milk is going to protect the baby rather than causing any harm. So even if you are suffering from any kind of cough, cold, fever, just wear a mask and please continue feeding the baby. Then one more thing is, most of the mothers would tell that my mother or my grandmother has told me to start giving feeding early because baby will get weak by 4 months or 3 months. So again, we have to highlight that this is a myth. Nature again tells us how it goes is the baby should be breastfed exclusively for 6 months, first 6 months of life. In the sense, apart from giving breast milk, nothing should be given to your baby. Now, earlier it was around 4 months, and then it was extended to 6 months of exclusive breastfeeding. The reason for that was they studied that those babies who were started early weaning in later childhood or later adulthood, they were found to have things like obesity, metabolic disorders. So early weaning, when a baby is actually getting good breast milk, can lead to more problems rather than doing any good. So all the mothers should be encouraged to breastfeed exclusively till 6 months and then start weaning afterwards. But please continue breastfeeding as long as 2 years or beyond. I hope it all makes some sense, and I hope the message is very clear. And another myth what we come across is, if I have seen a common practice in rural areas also, that mothers, when babies get some eye discharge or something, mother tend to put the breast milk into the eye. I know it's not related to the feeding, but what I want to highlight, probably it's the right platform to tell that please don't do that, because of course breast milk has anti-inflammatory properties, we know that, but it's not like, that's how it works. It has to get absorbed and all. So eyes are very sensitive, and when they tend to do that, it can actually lead to ulceration of the eyes, and even it can lead to a blindness in the baby. So my humble request to all the mothers, those who follow this practice, please avoid this, because it's not going to do any good to your baby. Seek medical help, get it rectified, things should be all right. So with this, I think I would hand over to Dr. Lal again, and I'm happy to have any other questions, any other myths which I have missed. I would be able, I'm sure Dr. Lal has many more questions to be asked. So I will be happy to answer them.
Thank you very much, Dr. Gupta, for giving very candidly and explanatory all the myths whatsoever are common myths which the Dr. Gupta is coming across from the newly mothers, and the myths which are very common in India. And I would just like to highlight few. First thing, he has given a good news. He says the breastfeeding in India has increased. And it has increased because the awareness is more and people are understanding the importance of the breastfeed. But what he says, because of the COVID, lots of myths have come, and there he has given lots of advice about the COVID. First thing he says, the COVID, even if the mother is suffering from COVID during the pregnancy or even during the breastfeeding, she should not stop breastfeeding, with some precautions which Dr. Gupta has explained very clearly, wearing the mask and keeping after breastfeeding, keeping the distance. But according to Dr. Gupta, no, the breastfeeding should not be stopped in any case, because the myth is that the virus will be transmitted to the child is totally wrong. The fact is that no virus can be filtered, because there are lots of mechanisms, and nature has made such a thing in the human body that when a mother is feeding, everything is, the milk which is going to the child is perfect for the need of the child. And he has given one figure which is really alarming. He says about 800 strains of bacteria are also going to the child, but he says this bacteria is beneficial for the child because of it might be creating and it is creating the antibodies. So he says one should never go for the myths which are happening, and exclusively he also says that all the organization, whether WHO, Indian Pediatrics Association, or the ICMR, everyone is recommending 6 months exclusively the milk, the breast milk, no other things to be given, which is very common in India, because mothers or the grandparents or grandmother always wants to feed. They want to see the child overnight become tall or like that. So they used to feed. And if the child is weak due to many reasons, they feel that the breastfeed is not sufficient and we have to give the milk or the formula, which is totally wrong. According to Dr. Gupta, we should not do it. Many times it happens the child's cry, and they say, oh, it's crying means empty stomach. Give the feed, your breast milk. Generally, I have seen the grandmothers always say, whether there's a maternal grandmother of the child or the paternal grandmother, you are not giving the milk properly, we will give the top feed, which is wrong, totally wrong. One should not do it. And he has mentioned one thing, when the mother is feeding, it's a pleasure. It's such a eternal pleasure she is getting. So one should enjoy while feeding the child. So it gives a positive vibes to the child also. So he says we should be very clear. We should not go for any hearsay whatsoever people are talking. One must give the milk, breast milk to the child, breastfeed as much as possible, but minimum 6 months exclusively. And he has given lots of myths and he has clarified. I'm sure all our viewers, and especially the lactating mothers or those who are going to deliver the child soon, will be benefited with the doctor's opinion and doctors' very knowledgeable answers for all the myths what are common in the country. Thank you very much, Dr. Gupta, for giving such a vivid and very exclusive things about this. Definitely will come back to you with some questions. But now I would like to invite my next panelist guest, and she is Miss Joyce Jaya Seelan. Ms. Joyce is the lactation consultant and family counselor, Fortis Hospital, Bangalore. Ms. Joyce, you have heard what Dr. Gupta has mentioned, and he has given lots of details. The common thing which he is coming across, because as a pediatrician, the newly becoming mother came are visiting him and asking those questions, and he has clarified lots of myths. But you being a lactation consultant, many times it happens that the mother hesitates to ask many questions to the doctors, especially the male doctors in India. But they are very frank with the lactation consultant like you for the gender ways. If although it's wrong concept in India, but many, I'm not saying everyone is doing, but few of them. So we have to understand from you now, because you are always there giving them the consultancy, and it is very, very important for a counselor to counsel properly. Doctors can advise, but after all, the follow-up has to be done. What doctors had advised, how it is to be follow-up, is the counselor's job. So we would like to know your views on breastfeeding myths and facts. Ms. Joyce Jaya Seelan, please.
Thank you, Mr. For calling me, and especially I thank the whole organization who's just brought out this to bring out the whole global information. I'm very happy to speak about that. First of all, when I say breastfeeding, let me go from the rooting of that. And first is WABA, World Alliance for Breastfeeding Action, brought out the latest program, which is called IYCF. What is IYCF? Infant Young Child Feeding it is. Infant and young child feeding is very important. What's that infant young child feeding is? During antenatal periods, when the mother is third trimester, when she's 7th month itself, give the information to all the mothers. And once the information is given, she herself develops how to go with the breastfeeding. She'll be prepared. When the mother, in my experience, wherever I have counseled the mother, prepared the mother before the delivery, there are so many things. We started a new program called Baby Sutra. This Baby Sutra is music therapy, thinking the baby, talking to the baby, caring of the baby. There are so many beautiful things which goes. There, a mother prepares for the breast and breastfeeding. Number 2, as soon as the baby is born, we will prepare the mother where the baby will be put to the breast within an hour or within immediately. And amniotic fluid and the breast areola smells the same, where the baby can able to really go through. And I want to show the model of the baby. Usually a mother will think when the breasts are there are beautiful tiny glands, which is called mitochondrial gland, which will produce oil and antibody. And mother should not be scared whether the baby will get infection. Of course, bathing, cleaning is important, and this is great advantage. Next one is the baby, once if it's put, the baby goes into that and baby takes into supine position like this. Once the baby takes the first milk which goes, whichever babies, in my experience, immediately took the colostrum, which is pains inside the rectum, till the rectum, inside the intestine, which will have the first antibody. After that, baby will get used to drink very well. The position attachment problems will not be there. Number 2 is 6 months exclusive breastfeeding. As we are going 6 months exclusive breastfeeding, especially in Asian Pacific, from 1991 onwards, this program came. 92 onwards, we were the state level trainers and also to the medical college and nursing college. And it was not so easy to convince them, because before it was only 3 months exclusive. breastfeeding. And to make it 6 months breastfeeding, it was really to work it out, because it took so long to convince rural as well as medical professions also. Now it is really working out very well. What is the 6 months exclusive? The no other feeds, especially in India, we also tell them not to give in the bottle feeds, because infection chances, sometimes nipple confusion will take place that way. And we tell them to give the cup feed, spoon feed, palada feed, etc. And moreover, this time the position attachment is very, very important. Most of the mothers will have sore nipple, cracked nipple, less milk, no milk. All those things will come because the position is not okay. I don't want to go with the pictures. I'll show in the hand only. For an example, this is the tongue, and there is a soft zone and hard zone inside. Whenever mother's breast goes, when it goes on the tongue, the crack can able to take place. When it goes to hard, the sore nipple can able to take place. When it goes inside, beautifully the ejection of the milk will go. The sore nipple and the cracked nipple, reason is wrong position, wrong attachment. Once the nipple goes inside, and it will eject beautifully, where the milk will heal, because the nipple will go into the milk. Immediately the cracks also can able to be healed. Only thing, mother should keep the baby. There are so many position attachment. Whenever mother is carrying, she should carry in such a way the baby's tummy and tummy, baby should look at the mother's face, and always the mouth should be everted, and completely baby should take the areola. When I say areola, most of the time, all the areolas will not be the same size, but anyway, mother should not have pain while the baby is sucking. Next is, after 6 months, complementary food is IYCF. What is that complementary food? Home preparation. In India, we always, work with the home preparation only, and what to give it to the baby, how to go with the recipes and all we will give, and take that complementary food, continue breastfeeding 2 years and above. And these 2 years and above, mothers, we will educate before itself. Mother will be benefited more, preventing breast, uterus, ovarian cancer, diabetes, hypertension, etc. And the baby, which from 0 to 1 year, baby will benefit a lots of nutrients, antibody, because the colostrum itself is having such a rich content of nutrients, and especially antibody, white cells, laxative. It is going to take immediately when the baby takes, even the meconium can able to easily pass and prevent the jaundice. Most of the mothers, immediate after the birth, the confident within them, counseling is nothing but help the person to help themselves, because every personality will be having their own strength within them. I always work it on SWOT: strength, weakness, opportunities, and threats. Most of the time, when we counsel the mother, she'll be strengthened to feed the baby. And most of the time, when the mother is, threats are, fear is different, threats are different. Fear is within the personality, threats is coming from outside. Most of the time, mother weakness, threats can able to take it. What all the myths you said, and those myths can be rectified with the SWOT: strength, weakness, opportunities, and threats. And especially the mother who has the less milk, no milk, and all those things, because of two hormones. The oxytocin is psychosomatic hormone. Always when the mother is really worried about something, the milk can able to go down. We should counsel the mother. Prolactin hormone is, as the baby suckles, next production of the milk will be ready. So whoever wants to ask question on this, I'm ready to just share with you. I'm very happy to call and coming and sharing in this media. Thank you.
Thank you very much, Ms. Joycey Jayashilan, for giving such a, I will say, you have shown how the mother should be fed. Mother should feed the child, breastfeed. And she has mentioned few things which are very interesting. She says IYCA, then Baby Sutra. And she says earlier it was 3 months exclusive, then it was converted to 6 months exclusive somewhere in 91, 92. And it was very difficult to convince the mothers, the families, and even the medical practitioners to convince them that now it is not 3 months, but the 6 months. But she says that how the time passes and now people are quite aware about the 6 months thing. But initially it was only for 3 months. And she says the position is very important. And she has shown practically with the models that how the breastfeeding should be done ideally, and how the mother can also enjoy, and the child should also get the proper milk in the breastfeeding. And she says the breastfeeding should be not less than 2 years and more, but minimum is 2 years according to Ms. Joycey. And she also gave something new, although which is very common in the corporate sector, that is a SWOT analysis, which we generally use the term. But she says even for the child and the breastfeeding mothers, the SWOT, which is stands for strength, weakness, opportunities, and threat, are very important to understand. And once they understand, then definitely the mothers will not only enjoy, but they will properly feed the child. Thank you very much, Ms. Joycey, for giving so much very candid, very vivid, and very practical knowledge today. I'm sure today's program is going to be a very, very remarkable program, especially for, and I will mention this in my next round, but I will say it is not only for the mother who is breastfeeding, it is for the entire family, because mother always wants to feed the child many times, but it is the pressure from the family, especially in India, where they feel that it is wastage of time and she is taking excuse, she must come to the kitchen, and although especially in the rural areas, etc. So one has to be very, very clear that even the family should understand how important is a child. When the family celebrates the birth of a child in a very, very big way, then they should also understand the child should remain healthy the lifelong. And for that, they have to sacrifice few things. Sacrifice means they should give the private time to the mother, lactating mother, so that they can give the breast feed to the child, as explained by our both earlier panelists, Dr. Gupta and Ms. Joycey. Thank you very much, Ms. Joycey, for giving such a good and good explanation with full of knowledge. Thank you very much. With full of experience also, I must say. And I really enjoyed the SWOT analysis, because till now I have never heard anywhere, except the corporates. Yes, we used to do this SWOT analysis very frequently, but there's a new term which I heard. So I will definitely like to enlighten it whenever I will be talking to the mothers or the families. Thank you very much. Now I would like to invite my next panelist guest, and she's Dr. Rukhsana Hassan. Dr. Rukhsana Hassan is a renowned, Ms. Joycey, please mute yourself, audio mute, please. Dr. Rukhsana Hassan is a renowned psychologist, trainer, coach, motivational speaker, special educator for early childhood education and development, a specialized counselor for the drug abusers and alcoholic with an experience of 28 years in rehabilitation center. She holds a PhD in social work in humanity from USA. She is postgraduate in Master of Arts from Mysore University, postgraduate in dietetic health educator from St. John's, Bangalore, and postgraduate in human rights, New Delhi. Her second PhD from Mother Teresa University is in counseling psychology. Presently, she is doing her third PhD in applied science from Rajasthan University. She completed her research in a project about CSW in Bangalore city under Women and Child Development, Government of Karnataka. She has done research about addictive personality, child development psychology, CDP. It was done with the Children of Observation Home Boys Government of Karnataka. For the outstanding service towards humanity, she was awarded Indra Priyadarshini Award. She is the nominee of Kittur Rani Chennamma, Government of Karnataka, as the Best Social Worker. She was awarded by Art Mantram Bangalore for Go Green Bangalore. She won Women's Achievers Award of N.A. Harris Foundation, Bangalore. She has presented her papers at many international conferences at Turkey, Istanbul University and Egypt, trained teachers in Delhi, Mumbai, Chennai, Hyderabad, Pune, and all over Karnataka. She was the counselor in charge of Karnataka State Counseling Center as an advisor for the Karnataka State Minority Commission 2011-2012, and also has designed pilot projects for the Government of India and Government of Karnataka. She is the founder chairperson of the first rehabilitation center. She is the first minority women in India to have started such a unique, challenging program. She designed mobile computer and tailoring training units with the help of Ministry of Labor, which benefits for the minority girls who are denied education for various reasons. Her title is Smiley Girl of the Town. She builds a new dawn in the darkest dusk, just with positive smile. Dr. Ruxana Hassan, welcome. And as usual, you are again smiling as you are known. And today's topic, I think some disturbance is coming from your side, Dr. Ruxana.
No,
Just see some disturbance is coming from your side. Please
I
see to
think
it.
the fan is on.
Please switch it off. It's a live telecast, so as Dr. Ruxana Hassan, you have come many times on our media conference and you have given your views very, very clearly. But this topic, which I must give credit to Dr. Ruxana Hassan, she only suggested me, why not do this topic for the benefit of many women and especially the mothers. So I said, definitely we would like to do. But only thing which I would like to know from you, because you are not only associated with early childhood education, but also with the drug abusers. Now, as our earlier panelists mentioned, then if the mother is breastfeeding the child will get the healthy body. And once the healthy body means that mentally also quite healthy. You might have come across with many type of children. Have you ever tried to note that what is the situation in India, breastfeeded child and not the child who could not get the breast fed at all? Whether they have also, any survey has been done, that I'm sure you can cover in the next part of the topic, because it's a very, very important to the mothers and the families to know how the child psychology goes when the child becomes adult, if he or she has been fed mother breast milk or not. But now I'm on the main topic, the breastfeeding myths and facts. Dr. Ruxana Hassan, please.
Yes. Thank you, Lal Goel sir. And I thank Yogesh Bhatt and Joyce, who has come. Just one word I told them as they have come. I thank you, both of you. Joyce has rightly said that we start counseling the mother. Now we start counseling the mother when she is 6 months and after. But what we fail, why I have taken up this research of early childhood. My early childhood is not after the child is born. I am not worried about after the child is born, finish. Like, this is the finished product. I can't do anything. I have to accept it, whether it is white, yellow, green, whatever it is, I have to accept it. But before I make this, before this has been produced, how many parents, how many mothers, how many families are planning for it? Because right now I have 29 girls, 29 women who would be mothers. Out of the 29, I think only 2 of the couples have spoken, yes, we want to have a child. This should be the condition. This will be the thing. So they have planned the entire thing, what exactly is pregnancy, how the pregnancy will work and what it is. The irony, what I have seen in many of the cases and many of the drug addicts and things, we are producing a product which is going to be utilized in various forms for the next 60 years, at least 60 years. Let me take the government age of 60 years. How much are we planning? Who is planning for it? What is the future of that particular child? Do I expect a boy or a girl? And if it is a girl, what is the outcome of it? how does a child get rejected as soon as the child is born? Okay, all this plays a major fact in this entire process of breastfeeding. And now the mother, now coming back to the mother, how happy is the mother? As Joyce said, the music therapy and all the other therapies we do for the child, we do for the mother, so that, she has an healthy motherhood. What about the father? This is $1 million question, especially in India, that after the first child is born, there is a tradition that, the first child goes to the mother's, for the first birth, she goes to the mother's house, and then the husband doesn't come. All these traumas, all these acts, all these things work a lot in the motherhood and also in the child. We say that, when you are feeding, please avoid alcohol, please avoid drugs, or please avoid the drugs. Even when we go to the doctor, they say, are you feeding? And the tablets are different. We don't give. The doctors take the precaution, but it is not the doctors who have to take doctors takes precaution only for one time, and they tell and they go. But what about the mother who is, observing her, who is giving her all those things? As you rightly said, especially if they are in a joint family, the baby is crying, they try to give, water, milk, or, usko bottle mein pilane ka sikha do. So you give a bottle, you don't waste your time. The moment the only thing what the parent sees, what the mother-in-laws, the in-laws will see, that, she has to go and she has to sleep, and then she has to sit, and then she has to feed her baby. That they don't like, because she's wasting a lot of time and there is nobody in the kitchen. So keeping that frustration, all this pressure, if she is feeding the baby, definitely psychological effect is there. I don't know how far this research has been taken place, but the research what I have been doing, like I have taken up a mother from a village and a mother who's working and a mother who's full-time at home. All these three mothers I have seen. And now the babies we can see, they are now 5 years, 6 years, and 7 years. We can see a lot of difference in all those things. But we as parents, we as in-laws, as an husband or as a couple, they forget all those things, and they just think that, feeding a baby for 2 years and above, or for 1 year, is just a process. It's just an act of the child growing up. No, it isn't. It plays a major role in the development of the child, mentally, physically, and also when the child has any such kind of thing. I recently, not recently, 2 years before, I had one case where the child was just 7.5 years old. 7.5 years, not even completed 8. The child says, I want to hang myself. When the parent came to me, and then it was in my school, when the parent came to me and said, this is what the child had to tell. I spoke to the child is so innocent, was not knowing in one thing about what exactly is hang. I said, I just took a thing and said, will you hang yourself like this? No, ma'am, I just told out of it. Then I called up the mother and I said, what was your pre-pregnancy, post-pregnancy, and the time when you are feeding the child? The mother had suicidal tendencies. So that will definitely, whatever they are thinking, whatever they are feeding, whatever they are trying to do at that time, whatever is the repercussion, it will directly come, the impact directly comes on the child. Okay, if you're angry and you just hold the child tight and you just feed, you can see that suffocation in the child. Recently, in one of the cases, just 2 weeks before, I met that couple, and the husband had so many complaints about the child. She is not feeding the child because the child is underweight. The child was 2 years and it was weighing only about 8.5. I said, what is your role in this? What is my role? I'm just a man. I have nothing to do. I said, come sit with me. And I said, I told him all these things. And then I said, see, when she is feeding, what are you doing? She's been feeding and you have been calling her. And what do you think she'll be? She will just be feeding her as an act. But mentally, psychologically, where she's on your call. This is what happens. As the mothers who, for the first time, when the mother is unable to feed, she has a myth. My breast is too small and my nipples are too small, so the milk is not coming out. No, as Joyce rightly said, it is just how you hold and how the baby gets it. And it's just the thing. No, my breast is only 32, so I don't have. So these are the many things where the first time mother, they are unaware about it. Later on, what happens? Then the same myth, patient ache, doctor ache. Most of the things, there are many doctor killers at home who have all those conclusions. Don't do this, don't do this. And if you feed the baby above 6 months, your body figure will go. The baby will not eat food. These are the few things, what has been very clear now in today's things. And the another wildfire what is coming up, they believe the WhatsApp and the Google search engine more than the doctors and the counselors, because they get the answer what they want. So this is another thing, which from the WhatsApp University or the Google University, the Google campus, these are the things what are coming up. But our experience is not from the Google or not from the WhatsApp University. We handle the case, we compare the cases. What if this is this and what if this is that? So we have the this and that comparison. Only then we come up with a conclusion. Only then we come up with a theory that yes, this is what it is. But most of the educated mothers who are 10th, 12th and degree and who have no working experience and other things, they feel, that yes, this is what. From where did you learn this? No, ma'am, I saw in WhatsApp. Did you ask some other question? No, ma'am, I got the answer for what I have, what I had to. So these are the few things which, like if you're feeding the baby, there is no need of giving other food. That's another thing what they have. If you're feeding the baby, don't give any other food until 1 year. So that means what is your intake as a mother? What are you eating as a mother? Because at the time of when she gave birth, she was 58, 59 kilos. Now when she's been feeding the baby, now she's 49 kgs. So what happened? They again have that thing, my weight and my I'm feeding the baby. There are so many myths about the facts, what it is, that they also have. I also have the question: Can my husband also suck the thing? I said that all these things have to be spoken very separately, and as an Indian family, we are not prepared to ask these questions openly. So this is one of the biggest myths what they have, what I can do and what I cannot do, when I should start and when I shouldn't. Because my breasts are small and my nipples are small, I'm not able to feed the baby. That's the reason I said, if we have that presentation, instead of our fingers and instead of our hands, we have pictures which shows, how exactly it was. Just because this is video conference, we are not able to show it live. I don't know, in the edited copy, if that has been given, that will have a greater impact, and the doubts what these young mothers, the new mothers have. And the role of the father is very important in the entire process. So that is very important because you will be a husband and a wife. They are two different individuals. Once you become a parent, it is a unit. There is nothing that, mother is one and the father is one. No, both the parents, the husband and wife, get promoted to parents. So what exactly is parenthood and the breastfeeding? Why breastfeeding is very important according to me? That is the foundation of your immunity. That is the foundation of what exactly your digestive system tells. So these are the few things before you want to become parents, before you want to become a mother. we have to start counseling this. I have told in many things, in especially in a place like Mangalore, in a place like Mangalore, talking about this also is a kind of social stigma. So breaking all those things, that's the reason I said, okay, let me start. The moment people, my contacts saw me, is breastfeeding. ये बात करोगी आप इस पर मीडिया पर? अरे हाँ, क्यों? तुमने ब्रेस्ट फीडिंग अपनी माँ का दूध नहीं पिया? हाँ पिया. तुम्हारी बच्ची नहीं पी रही है? हाँ पी रही है. So why should I talk? So this social stigma of talking about this particular subject should have an open platform, and many youngsters, many younger generation should come up with this kind of platform to discuss. That is what I feel.
Okay, thank you very much, Dr. Ruxana Hassan. And as usual, you have given very, very forthright, and you have spoken in a very, very straight way your views. And but very important point which Dr. Ruxana Hassan has raised, which is lacking in India. I have seen in other countries, it is not like that, but in India, that before even you are thinking to be a parent, please go and consult a counselor. Check up what are the plus and minus points, because many times it happens that the both husband and wife are working and they are in nuclear family. So they should be well prepared what is going to happen afterwards if they will become parent, whether this, because it should not happen that you are, and she used one word which is very, again, I'm saying that these words are common in the corporate sectors, or she says that people think that the child is a product. We are just making a product and that's it. It's not. You are creating a human being who is going to live for 60, 70 or 80 years. So you have to be very, very sensitive. So she says, please go, the parents, before even planning for the pregnancy, please consult a proper qualified counselor or a doctor, take their advice, and then only plan the pregnancy, because there are so many things. Tomorrow it should not happen that your child, the mother will be impacted, and in turn the father will be impacted. And she says, why only the mother is being given that much importance? Why not the father? The role of father is very, very important as far as the breastfeeding is concerned. And she says, because father has to see to it that the mother, breastfeeding mother, should be in comfort zone. Because if you are putting pressure, tension, and if she is breastfeeding, her mind will be there. And she says that psychologically, the child will be affected very badly. And she has given an example of a child of about 7.5 years old, that how he wants to do hanging. And when she inquired and she checked up, he says, no, I don't know what is hanging. Then she checked up with the mother and she found that the mother is having the hanging tendency. So one can understand that how your feelings passes to the child. So you should be very, very positive when you are feeding the child. And the family, she has also raised the same thing. The joint family concept in India is very good, but we should understand that if the daughter-in-law is feeding a child, they are nurturing a child for your own family. It's a duty for everyone to see that the entire family should be responsible to see that the mother should breastfeed in a comfort zone without any tension, because it should not happen the child started crying and she's just rushed out from the kitchen, feed her, and she knows that I have put something on the gas stove and I have to rush back. The child will not be fed. So what she is making is that it is very important. And one very important point she has mentioned about the WhatsApp university. She says, nowadays parents or the mother, they say, no, we have seen WhatsApp, that's so and so, but they are lacking. One should go and consult the doctors, because whatsoever the myths are being, earlier the myths are from the family, now the myths are from these WhatsApp, so-called WhatsApp universities. One should consult the counselor, one should consult the doctor before taking any decisions or following anything which is not correct. might not be correct. So one has to be this thing. And one very important point she says about the social stigma. Yes, this is a very, very, I must say, the very important point, especially in India, where people feel it's a social stigma to talk about breastfeeding. They have that type of feeling कि breastfeeding. Even I have seen in the society, if any mother is going to breastfeed, people are seeing her as a very that she is not a properly educated, she is not a high society. That is totally wrong. There are ways, there are many ways how one can breastfeed the child, which is very, very important than any other work for a mother or for a family. Thank you very much, Dr. Ruxana Hassan, for giving such a, I must say, very, very exploiting, because you are such who can change the trends of the society and remove these types of stigma, which is very, very much important in this context. Thank you very much, Dr. Ruxana Hassan. Now my question goes to Dr. Gupta. Dr. Gupta, do you think this, like Dr. Ruxana Hassan mentioned about the social stigma, do you think we as a civil society, we as the government, we as the medical practitioner failed in our duties to remove this social stigma by not creating a proper awareness? We are in a double standard. We would not like to show any mothers, even in a model way, not in a proper mothers breastfeeding a child in an advertisement, or telling the creating awareness by the government, like we have done in COVID-19 or in other places. Why not a very big social, why not we should come out with a social awareness campaign in a big way? Don't you think that is required? And as a member of Indian Pediatric Society, as a medical fraternity, do you think your association should take up this cause and ask the government of India and the state governments to at least start campaigning so the mothers or the child should not suffer? What you say about this, Dr. Gupta?
Absolutely, I agree, sir. These things are still taken as a social stigma, and the problem is breastfeeding. Once we start giving importance to it, because as I said, only as per the numbers, 50% of the India only mothers only breastfeeding. Of course, the numbers are better, but still other 50 are not yet breastfeed. They don't breastfeed exclusively. So let's target that population also. So I think first of all, we need to have education, okay, and give education about the importance of breast milk, why it is important, why is such a wonderful thing which God has gifted, and which is a gift from the mother to the child. What are the benefits it has, what are the protection it does. So, and of course these are things are there in the books, but it never comes in the public. So books wise we will be only doing it, and it's our job to educate, but of course we cannot reach to everybody out, and only one thing which can reach out to everybody is a media, especially a visual like a media where news in the advertisements. I think it's a wonderful idea, but only thing is the effort should come from the straight off the society, including the government, including the bodies which are kind of are responsible for child health and mother care. And it should be emphasized, and so that mindset, or the people's mindset about breastfeeding, as Dr. Ruxana very nicely mentioned, I think that has to change. And only one thing which can do this change is education. I think we need to kind of educate all the strata of the society, and highlight the importance of feeding till 6 months, like how we have been doing now. I think very good, sir. I think I agree with you with this, and if I can be a part of this, I would be more than happy to.
Thank you very much, Dr. Gupta, for offering your services to be part. I will just tell you, recently on the 14th of August, we did a program with the IMA on organ donation awareness program, and in which the National IMA President, Dr. Jailal, as well as the National IMA Secretary, Dr. Lele, and all other doctors who are connected with the organ donation or organ transplants, as well as the NOTO director, Dr. Jayanti, they all were there and they have given their views. And they all agree that the government and the civil society should create the awareness. Similarly, because the figures which are very alarming after even if one baby dies for lack of breastfeeding is not at all acceptable. We should not be acceptable in the society, civil, when we are in the 21st century. So I'm sure if your Indian Pediatrician Association or even if your any other association would like to organize programs, media conference with Lal Goel is always ready to create such type of awareness. Unfortunately, the national media is only busy in the breaking news. They just want the TRPs. We are not bothered for TRPs, to be very frank. We are doing this program for now more than 1.5 years, and with the cooperation of leading channels like V4 News, the Global TV, and other regional channels, and they have. And this is totally a social work. One should understand, after all, you are creating a society. We want to donate the money in temple, church, mosque, etc. Why not we just create this type of awareness so that at least we are going to do something for the next generations or the generations which are going to come and which will be going to make our country proud and a global leader in the world. Thank you very much, Dr. Gupta, for giving such a good advice as well as a reply of my question. Now my question goes to Ms. Joycey. Ms. Joycey, in UK, the NHS system is very clear that even in the postpartum care, the counselor, the midwives, they visit the house.
Yes.
They see that they check the women's as well as the child health. They see how the lactation the process is going on. Everything is fine, and even they are so strict. If they find that the mother or the father is not taking proper care, they take the child to the government organizations, NGOs, and they ask them to learn. And there is a program earlier also to train them. Why not in India? If like you are representing a very, very reputed chain of hospitals, even if you, whosoever is registered with you, if you will start, I don't know whether you are doing it or not, but if you will start a home visit after the certain weeks or days, as per the, like you can check up in the NHS what they are doing, you might, I'm sure you are might be. So that will give a confidence not only to the mother but to the family, because as Dr. Rukhsana Hassan said rightly, today the young girls or boys are taking help of WhatsApp University. If anything goes wrong, but the child was fed 1 hour before or half an hour before, she should or he should not take more than this much. It means some problem is there. They just go on WhatsApp and they say, you give this, you give honey or whatnot. This is totally to be avoided. What you say about these types of counselors visit at home?
Yeah. First of all, what you suggested, home visits. We are also planning, there are also some of the units, they do the home visits, but they should be having proper curriculum or proper points where they can able to go and observe for the breastfeeding. We are also planning to have this home visit and to train the mothers, first of all, train the nurses or the counselors. And moreover, more than the nurses, the counseling part is very, very important for everybody to go through. And once if they are doing that, they can. And moreover, a mother, we always train father and mother together during antenatal periods itself, because father takes very, very responsibility if he's been motivated. It's a house. And always in the parenthood program, what we conduct during the 7th month itself, we call father and mother both together. We'll give them the exercise of carrying the baby, holding the baby, position attachment, how to help. This will continue throughout their life. No, it will be very much motivated one. Next one is, most of the time, mother or the father should feel this life, what I'm giving to my baby is something great. I always tell them, everybody, even our medical profession, when you start feeding the first time to the baby, you are saving one citizen to our country. Because Rabindranath Tagore said, God forgives always, man forgives sometimes, but nature never forgives. Against nature, they should understand. Nature provides such a beautiful things. We are not aware of it. We are mostly on the technical side and, Googling and going. Moreover, the nature is already given the gift. We are not understanding. The counselor should make them to understand, strengthen them. They have the strength within them to go through. This kind of motivation, everybody can able to, because I worked in the rural areas and tribes. They are so sweet. They are so good. They get into the next to nature. They know what is nature's providing. And I always think Mahatma Gandhi in India, what he says, every child come to this world, right of freedom. Whoever takes that freedom is equal to murder. Murder is not life murder. It is a health murdering. It is a social murdering. It is a personality murdering. All the things we do go through, and we are not aware. Any medical profession, any counselors, those who are working in this field has to be mainly trained on counseling and what are the personality to develop. One child is fed properly, one citizen can able to be made by in our country. This kind of feelings is very, very important. That's why Napoleon said, if I want to become a good citizen, I need a good mother. So why that mother, whatever is eating or drinking through the mother, it will be.
You have muted yourself.
Only feeding the breast milk nutrient values. She's also giving the bonding, because studies are made, the bonded babies with the breastfeeding, when they come to teenage, suicidal impulses are not to the higher level. Today, we see so many suicidal impulses when we take the history and before birth and while breastfeeding, how it was. This also give the impact at the back. So what Dr. Ruxana, she is very good friend of mine for the past so many years. And we used to work together, and very, very interesting to know we are helped to so many people, so many rehabilitation also. I'm so happy to share this. And we go touch the children from the beginning, and before birth, we can able to develop our children beautifully till their lifetime. Thank you.
Thank you, Ms. Joycey, for giving such a beautiful words about the breastfeeding. I am sure if the country is having such type of counselors, we don't require anyone, because the way you have quoted the Rabindranath Tagore, Mahatma Gandhi, and Napoleon, it shows that your knowledge and your practical knowledge and how to convince a mother, a father, and a family, which is very, very important. Thank you very much. And I'm so happy, and I'm sure all our viewers are enjoying today's program with the knowledge, abundant knowledge our panelists are having in this subject or the breastfeeding. Thank you very much, Ms. Joycey. Now my question goes to Dr. Ruxana. Dr. Ruxana, you have tried to put blame on the father. You have tried to put blame on the family. Yes, I agree. They are the main culprit. But don't you think that the breastfeeding, especially exclusive breastfeeding, ties a woman to her baby? And some women, I'm saying some women, I'm not saying everyone, may feel that they have lost ownership of their bodies. This loss of body as autonomy can affect their self-esteem, sex life, and body image. Women who pump breast milk may also feel uncomfortable in this process. So it is not only that every time the father or the family is to be blamed. Many times it happens that the young girls or the young mothers, they feel it's such a waste of time. Why I'm doing this? My body, what I will show in my society, where I am going, I am supposed to be like a beauty queen, and there I am going and feeding the child. What you say about this, Dr. Ruxana? I think you are on mute, Dr. Ruxana-san. Dr. Ruxana-san is not there. I think some problem with that. Okay, so now I am going the same question to Dr. Gupta. Dr. Gupta, you might have come across with lots of mothers, young mothers, those who have the professions, those who are in modeling line or the celebrities, although nowadays the celebrities are also showing openly, like Kareena Kapoor and many, that breastfeeding and parenthood is a very, very noble thing and a very pious thing. But many girls who are working in office and who has to work, join after 3 months or 6, now this is 6 months, after 6 months, and they feel uncomfortable for breastfeed or to pump the milk. What you tell them and what you want to give the message to the entire society or the country?
Yeah, Ratlal very rightly said, though the number of these kind of issues are actually kind of less what we used to see earlier. So what I always tell them, look, you have to prioritize certain things in a life. So one thing is your priority, the baby should be your priority. Leave everything apart. As you said, when you're feeding, so it should be you detach yourself from rest of the world. It should be you and your baby, and that's all, nobody else. And think that you are doing all this just to ensure that your baby has a healthy life, a healthy future, a healthy psychosomatic development. And if you keep all those things, in your mind and just go ahead with the feeding, then I don't think so anything, any kind of environment, any kind of stimulus can prevent you from doing so. Another thing is, yes, some girls are actually a little more concerned about, their body image and all. So again, it just needs, we just need to sit down with those mothers, and what we do is basically kind of counsel them and tell them, look, all the breast, once you explain the benefits of breast milk and breastfeeding, most of them will always, agree to continue to do so. And I have not come across, when we talk about this and when any mother has refused, because all it depends is how you convey, how you put across the things. So, and another thing is, still in our corporate setup, of course, the things have changed, but there are certain government setups also where, we need to have certain things. We need to give, as you rightly said before also, these things are not given priorities. So I think we need to give priority that mother who has just come out of delivery, or who has just, come out of 3 months of maternity leave, there should be some place where she can go, there she can express the milk, can store the milk, and all this thing is actually doesn't require much manpower, investment or nothing. All you need is a small area and a fridge, so that, but again, doing things is not easy, but it's just the mindset, so probably if we start highlighting, once we start highlighting these things, the importance of milk, the importance of expression, importance of continuation of milk despite, you are on work, and working ladies also can continue to breastfeed. So all this importance, once we highlight through media or through print media, I think, and then with the help of government bodies also organizing these things and arranging for these things everywhere where the women's kind of, they're working, I think these things can be tackled. It's not impossible, but only thing is the effort has to come from all the areas. It's not only you or me, or the mother. It has to be everywhere and put efforts together and make it possible.
Okay, so I think, thank you very much. Thank you very much, Dr. Gupta. Dr. Rukhsana, I think I can see you. You have come back. As usual, you always lose the connection at the end of the program. Dr. Rukhsana, can you hear me? Please unmute yourself. Dr. Rukhsana, are you there? Please unmute yourself. Dr. Rukhsana, please unmute. No, I think connection is a problem with Dr. Rukhsana. She's trying, but she can't be. Please unmute if you can. No, not at all. Okay, no issues. I will be going to Ms. Joyce for the last word for just a 30-second. Do you think in India, although I have asked this earlier also, I mentioned also, the family counseling is more important than the mother counseling? Because whatsoever is happening in India, the family is putting pressure. Even the mother is getting the knowledge from the counselors like you, but the family, especially I'm talking of the grandparents or the father or mother-in-law, and even the husband. Do you think we must train them?
Okay, let me say that whole family should be convinced. Whoever is very close to mother-in-law, mother, and their sister also who's taking care, first of all, husband and wife should be counseled during antenatal period. After that, whoever is linking, I always ask them, who's going to take care of you at home? And when they say my mother-in-law, my mother is there, I try to see that, I counsel them. When we counsel them, let us not use the word don't do this, do's and don'ts. No, we can able to promote and say that the great advantages which you are helping. Those who are unable to do it also, they will try to do it.
Okay. Okay, you have on mute. Okay, you have made a point. Thank you very much. Paucity of time. Yes,
Yes.
Ms. Joyce, you have made a point. So thank you very much. So viewers, you have seen today how the breastfeeding is important, and it is not only the mother importance for the mother to feed the child. It's for the entire civil society, for all of us. After all, we are making a good citizen. Once the breastfeed, and whatsoever the myths are there, please don't consult the WhatsApp University. Consult only a counselor, a qualified counselor, or a doctor, and ask them whatsoever you have a myths. But don't do anything after you are playing the life of a child, either physically or mentally. And please try to do something, because it's not the only liability of the doctors or the counselors or even the government. It's the liability, it's the responsibility of the civil society. After all, child is ours. If we are not taking care, who is going to take care? Thank you very much for joining us. And today's program has been live telecasted by V4 News Global TV, V4 Stream, Malnadu TV India, News Gaon se, Samvad Sarokar News, Bharat Post News, as well as was shown live on Facebook and YouTube. And our enjoy in our evening program of Kal Aaj aur Kal Lal Goel ke Sang, where we call one achiever who is a role model for the youth. Today, my chief guest is Mr. Tom Sairek, Vice President and Business Head, Auto Finance, Behwan International Group Holding LLC, Sultanate of Oman, Muscat, at 4:30 p.m. So please tune in today for Kal Aaj aur Kal Lal Goel ke Sang at 4:30 p.m. Thank you very much, Dr. Gupta. Thank you very much, Ms. Joyce, and thank you very much, Dr. Rukhsana Hassan, for joining and giving such a elaborate your views and thoughts about the breastfeeding. I am sure that our viewers have got so much first-hand knowledge today, how they have explained. And even if they have any doubts, they can very well send on our either the V4 News portal or the Global TV portal, so that they can be forwarded to the respective doctors or the counselors, as the case is. Thank you very much. And thank you all the viewers for watching our show and getting the enlightenment from our panelists. Thank you.